Hi, thanks for joining us in this 3-minute demonstration of the Proprio Reactive Balance System. Like you, we're invested in making your patients better and your practice more efficient and profitable. Since many balance problems and most falls occur when someone does not react appropriately to an unforeseen event like a patch of ice on the sidewalk, suddenly stopping bus, or poorly executed step, we created the first commercially available reactive balance machine. Making postural adjustments in reaction to these unanticipated stimuli is called reactive balance, and it cannot be improved without disturbing the patient's balance and forcing them to react. Like a typewriter, our competitors use decades-old technology and are limited in their applications. The Proprio system is the only multi-planar, multi-directional balance system to objectively assess and improve postural control. It's used to evaluate and rehabilitate balance problems resulting from neurological conditions, orthopedic injuries, and vestibular dysfunction. What makes us unique is our computer-controlled platform that creates surface perturbations and our ultrasonic measuring device to objectively evaluate center of mass movement and body kinematics. The movement of the computerized dynamic platform is controlled by the clinician rather than the patient, making it safer and more accessible early in the rehab process. The therapist controls the speed from 12.6 to 126 degrees per second, direction, lateral, anterior, posterior, clockwise and counterclockwise, and random, and degree of platform movement from 0 degrees to 25 degrees. The Proprio's dynamic platform allows for reactive and anticipatory balance training, replacing the need for other balance devices. Because the level of difficulty is controlled by the therapist rather than the ability level of the patient may begin closed-chain proprioceptive exercises much earlier in the rehabilitation process, since the fear of unwanted platform movement that can cause further injury is removed. This ultimately can shorten the rehabilitation time. We also measure balance differently than our competitors. Balance is defined as maintaining one's center of mass over one's base of support. Force plates measure center of pressure and not center of mass. To measure center of mass, we place an ultrasonic sensor on the lumbosacral joint of the spine. The sensor uses dynamic motion analysis to measure all 6 degrees of freedom: lateral medial, interior posterior, superior inferior, rotation left and right, lateral flexion, and flexion extension every 1/4 of a second. This objective documentation of the patient's body symmetry allows the analysis of postural deficiencies like weight shifting and body kinematics. This information can be used to establish a baseline and show improvement due to rehabilitation. In this brief video, we've shown you how our patented perturbation technology and objective measurement of postural control makes the Proprio system the leader in reactive balance rehabilitation. To learn more about our standardized tests, biofeedback training, and ongoing research, see us on the web at www.peridynamics.com.